How are you?
Good, how are you?
Good, I'm doing well. Taylor, where's our hand sanitizer? You're gonna have the hand sanitizer, where did it go? That was not a one-time deal. This is an ongoing emergency. We need to have ongoing sanitizer. All right, so why don't one of you guys stand back over there? Okay, great, thanks. And when I get done talking, I'll be back here, okay? So that's how we're gonna keep our social distancing. Well, again, everybody, good afternoon. Thank you very much for being here for our weekday update with regard to what's going on the coronavirus. Again, as always, I want to remind people about the 10-person rule that we have here in the state of Nebraska. So over a week ago, the president announced a 10-person rule limit on gatherings across the country. And we have implemented that here in the state of Nebraska. And it applies all across the state of Nebraska, not just in our areas where we have the directed health measure. And this is really an attempt to make sure we don't have those large public gatherings and spread the virus. So I'd remind everybody that applies statewide. Also, we want people to continue to practice the good hygiene that we've been talking about as well. So again, wash your hand for 20 seconds. Stay away from people who are sick. 6-foot physical distance. You guys are a little bit closer to each other. Ken, maybe you should take a step up. I don't want you to get sick. You never know where that guy's been. You never know where our Commissioner of Education has been. So we want to make sure that, again, we keep that physical distancing to help slow the spread of the virus. And then, of course, one of the key rules is if you have those flu-like symptoms, so a fever and a cough and so forth, stay home. Look, if you got a fever for anything, you should be staying home, right? But if you got a fever and a cough, shortness of breath, stay home, contact your healthcare professional, and especially where we have DHMs already in places like Omaha and Lincoln and in, Three Rivers Health Department, which is Dodge, Washington, and Saunders County. Stay home, contact, and everybody in your household should stay home as well if you've got those flu-like symptoms. This is not just if you got allergies or a sore throat. This is, again, fever, coughing. We want you to stay home and everybody in your household stay home where we have a DHM implemented. It's all about trying to slow the spread of the virus. Now, we have another number of things that we're going to be talking about today. I'm being joined by a number of our guests. We've got Ken Hers, who is the president of the Nebraska Cattlemen. We've got Commissioner Matt Bloomstead, who's going to be talking about some of our educational issues. We're also being joined by Bill McDonald, Dr. Bill McDonald, who is the medical director for medical policy at Blue Cross and Blue Shield. And before we get to our guests that are speaking today, I've got an announcement with regard to another executive order that I have signed. I have signed today an executive order that is going to be waiving some of the license restrictions on healthcare professionals so that to make it easier to practice in our state. So for example, I'm going to be waiving the requirements of people who have their license in another state coming here to make it easier for those medical professionals from other states to come to Nebraska and be able to practice. We are waiving some of the requirements with regard to license fees. If you are getting those renewals, waiving the requirements on renewals. If you are new practice, again, waiving the requirement to that initial license fee, waiving the requirement to make sure that you turn in your tests before you can practice, waiving the requirements on supervision ratios, and then also waiving the requirement on the FBI background check to be able to practice. So again, this is, we're trying to get folks to start thinking about how they can come and help us out here or how we can make it easier for people who are practicing here, whether you're medical students, whether you're somebody who's retired and maybe looking at getting re-credentialed here in the state. We want to make sure that we have the ability to surge up to meet the demand that we may have as the coronavirus spreads here in our state. Now, currently, we have plenty of healthcare professionals to handle the current demand. But as we look down the road, we will see that we may need to have more professionals. And this is one of the reasons why we've prohibited the elective surgeries in our DHM areas, is that one of the things that does is free up staff to be able to take care of people who have the coronavirus. So we're thinking about how we plan this out. Now, currently, we are at 83 cases in the state of Nebraska. You may recall yesterday I said we were at 74. So what we're seeing is, at least at this stage, our number of cases is still progressing at an arithmetic pace. So it's not taking off on us at a geometric pace. But at some point, we may experience that. We want to be ready for that. So sitting at 84 cases today. Also, just talk a little bit about our testing. We believe that we've got the capacity now to do about 1,000 tests a day between the different folks who have done that. So for example, UNMC now has the capability to do the Roche test. They're getting about 1,200 of those a week. We're going to do about 180 a day. So that's another area where we've been able to expand our testing, and where we're going to be working on the guidelines through the Department of Public Health about how we may loosen some of the restrictions before you can get that coronavirus test, kind of along the lines of what we've talked about in the past. So we're expanding testing. As we expand testing, we should expect to see more. People test positive, nothing to be alarmed about. We're going to expect that. And we're going to get better data with regard to how this virus is spreading across our state. Also, some other just things I want to highlight is that we will continue to do these press conferences next week, again, 2 p.m. weekdays. We will continue to do this next week. I have a Facebook Live event at 3:30 this afternoon with Dr. James Lawler from UNMC. Dr. Lawler is one of the infectious disease experts that has helped us craft our policy here at the state of Nebraska. So he's going to talk about the importance of social distancing, and we'll have a Facebook Live that will last about an hour, again, starting at 3:30. Last night, we did a television town hall on NET, and we are expecting to do another one of those next week, so stay tuned for more details with regard to that. Department of Health and Human Services has a new dashboard with regard to showing how we're fighting the virus here in our state. You can find that at dhhs.ne.gov/coronavirus. So we've got a new dashboard up if people want to go check that out. Again, dhhs.ne.gov/coronavirus. Stay tuned for that, or go check that out. There have been rumors that CFS has discontinued visitations. That is not true. Now, we are trying to do visitations, telephonically or video conferencing or things like that. We're trying to find alternative ways to do it, but we have not discontinued visitations. That rumor is not true. And then finally, one of the things I want to talk about is, you may recall we have our Developing Youth Talent Initiative here in the state, our grant program to encourage companies to work with school districts around some of the high demand fields we have here in the state. One of our previous grant award winners was some schools in northeast Nebraska around Norfolk, and the Nucor Detailing Center. As part of that grant award, they purchased some 3D printers, and now 5 schools in northeast Nebraska are printing PPE for Faith Regional Hospital in New Norfolk. So again, a great example of local people stepping up, meeting the challenge, and doing the right thing, figuring out how to solve problems. This is why we're going to beat this virus, because we have people like that. Those young people are figuring out how to use a 3D printer to be able to print PPE. So great news story there. Now, what I'd like to do is bring on our Education Commissioner, Matt Bloomstead, to talk about some of our educational issues. I got to tell you, it has been a great working relationship, even before we had this public health emergency. It's been a great working relationship with the Commissioner on a variety of educational issues. We've been working very closely together as we've been going through this emergency, and I've really appreciated all the great work you and your department's doing. So with that, Commissioner, I'm going to turn it over to you.
Thank you, Governor. Yeah, I was going to say thanks really for this partnership, and with Cattlemen here, I was going to say it's a rare opportunity to work on this, but well done, Governor. So the reality is, for everybody, yeah, thanks for the drum roll. The reality is we've released some additional guidance this week for our schools, and I wanted to walk through some of those things. As we continue to see and be concerned about the spread of COVID-19, we want to ensure that schools are playing their role in ensuring the public safety, and obviously congregating a bunch of students in one place has the potential to expand the spread of the virus. So we are going to actually continue. My recommendation has been that schools actually continue in operation for the rest of the year under an alternate learning environment without students in their schools, right? And that we're having to build a process that allows schools to quickly be able to submit continuity of learning plans to the Department of Education. That's available for our schools already. They can submit those plans to us. It should only take them about half an hour to fill out these plans. It's not a deep, detailed plan. And then later in the year, when we look at it, we're going to be asking schools for a little information on what types of things were challenges, what are the things we could do to further help, how do we continue to provide resources for the education environment. It's been a remarkable lift by our schools across the state, by our teachers, by our local school boards, by our administrators, and I'm very proud of the efforts that have taken place all over the state, private, public, both types of schools. So one thing, though, I've been asked quite often is, what if it changes? What if the circumstances would change? What we're going to continue to do is work with local public health officials and ensure that if it ever became safe that schools could reopen, they would have to have the authority given to them by that local public health official or state public health official. So it's going to be important that schools and the Department of Education, and with the governor's help, being able to continue that conversation. And I only recommend that they would open up in a regular order if they were given that authority by state or local health officials. So the other part of this is e-learning, and there's been a lot of e-learning taking place. But e-learning and distance learning, distance can also be not by electronic means, but by otherwise. And schools are doing a remarkable job, and we put out some additional resources for our schools on that front. Special education, one of the big concerns for this environment right now is serving our students with special needs. And so we've really encouraged schools to be thoughtful about how they work with their parents and their families to ensure that their students are receiving the opportunities that they deserve. Also, we're asking the parents of students in those settings to be patient with our schools as they continue to build plans. It's a very unique circumstance that everyone recognizes, and we're really pleased with the level of coordination and cooperation that's taking place. I encourage schools to continue to think about their staff needs, and we're actually putting up guidance and have put up some guidance on what's a safe working environment in a school setting. We've had concerns that they're gathering in large groups. We want to make sure that they're thinking very smartly about how that environment will work overall. And then one thing on nutrition, our schools are providing food and continuing to do that to students all over the state. Again, a remarkable effort that's taking place. We've received waivers from USDA for some of those food programs. That's been a critical need in our communities, and we'll continue to do that work. And then really, I probably just a couple things. Graduation, I've had a lot of questions around seniors and what seniors are going to do. We're working with schools on some of those best practices right now. They're looking at certainly our graduating seniors that have already completed 3/4 of their school year are really in a position where we can know if they're making good progress. And I'm encouraging school districts to work with the students that maybe are concerned about that, but continue to do that work and ensure that students are graduating on time. And that's a critical part of that. And then kind of lastly, on a kind of a policy front, we did submit a waiver and receive that waiver from the U.S. Department of Education for our accountability and assessment systems. That was actually a very quick process. Credit to the federal government in this case. We submitted it, and about 3.5 hours later, we had our waiver. So that's a remarkable thing. Never seen that happen before, Governor. So that's all I got to say. And then lastly, I don't want our schools deeply worried about policies and rules and regulations. Obviously, safety and other things are critical right at this moment, serving our students as best we can. We've made our processes as simple as possible for schools to be able to follow, and we're providing a lot of guidance and having them work together to provide the best learning environment possible at this moment in time for all of our students all across the state. So with that, that's really all I have, and I'll turn it back over to you, Governor.
Great. Thank you very much, Commissioner. And again, Commissioner, one of the things I just want to emphasize again is, great working relationship. Really appreciate that. And also, as you work with these schools that are open without students, that the idea is that all these students are going to be ready to advance a grade in the fall. Is that accurate?
Yeah, that's correct.
Right. So again, the goal is through the end of the school year, expect to be operating without students in your schools, using those other alternative methods to teach kids, but getting them all ready so they can advance a grade for next fall. So next, I'd like to call up Dr. Bill McDonald, and before I do, as I mentioned, he is the medical director for medical policy at Blue Cross and Blue Shield. I want to say thank you to Blue Cross and Blue Shield for all your help and effort through this. One of the things that we have been really wanting people to adopt was telemedicine. This is something that doctors want to do, that patients want to do, and they want to be able to do this so that they can, again, limit the spread of that virus, make sure we're keeping everybody healthy and safe. And Blue Cross Blue Shield has stepped up to become the first company here in Nebraska who is going to reimburse those at regular doctor visits for telehealth rate. So if you're going to do a telemedicine type appointment, you'll get reimbursed at the same rate as if the person came into your office. That's exactly the kind of things we want to see here in the state. That is what we call leadership in a time of emergency. And I just can't thank Blue Cross and Blue Shield enough for stepping up and being the first company to do this. We really appreciate that. So Dr. McDonald, if you could come up and talk a little bit more about that. We're really grateful for your efforts here during this emergency to step up and really do what you can do to help make sure you're keeping Nebraskans safe.
Well, thank you very much, Governor Ricketts. Thank you both for your kind words and for the opportunity to speak to everyone for a few minutes today. You know, at Blue Cross and Blue Shield, we feel that our most important mission right now is to protect the health and the safety of our members. We also know that we cannot protect the health and the safety of our members unless we give our doctors and our other healthcare providers the tools to do so. You know, as the governor mentioned just a few minutes ago, our usual ways of doing business are not enough right now during this pandemic. And so because of that, we are proud to announce our new policy for telehealth. As the governor described, this is one of the most proactive and progressive telehealth policies in the country. Essentially, our telehealth policy will reimburse doctors and other healthcare providers the same for telehealth as they would for any kind of office visit. Follows the same rules. In addition, unlike usual office visits, there will not be copays to the patients. There will not be the cost sharing that you normally have. We really want to be quite aggressive with this policy. The benefits of this policy are going to be better access to the patients to their doctors. It's going to allow their doctors to provide care safely. And another benefit is going to be that we will be making payments that will help ensure that our doctors and that our other healthcare providers can keep their doors open and can stay in business during this pandemic. We want to thank the governor for his strong leadership during this crisis. Governor, your calls for social distancing and for self-isolation when indicated, those things are saving lives right now. And we feel that our new telehealth policy will fit very neatly into your plan. If we all practice good social distancing, if we all practice social isolation when it's indicated, and if we use telehealth when it's indicated, we're going to weather this storm. Thank you again.
Well, again, Dr. McDonald, thank you so much on behalf of the state of Nebraska, to Blue Cross and Blue Shield for this great leadership decision you've made. We really appreciate it. And I hope the other insurance companies in the state of Nebraska will follow suit and do the same to make sure that we can really offer the telehealth option to our patients here in Nebraska and to our doctors, and make sure that we can all get through this storm, as you said, safely and in a healthy way. So thank you so much. We really appreciate it. As I had mentioned earlier in the week, this is Ag Week here in Nebraska. And so we've been highlighting the great work our farmers and ranchers have been doing to make sure we've got a strong food supply chain here in our state and in our nation, and indeed helping to feed the rest of the world too. We have the best food in the world right here in our country. And it's because it starts with our farmers and ranchers and goes all the way through that supply chain. We have a number of companies that have been stepping up to make sure that they're doing the right thing in this emergency. One of those companies I want to highlight is Nebraska Beef. Nebraska Beef has offered to pay a premium to the producers who are providing livestock to them this week, $8 a hundredweight. Tyson had done something similar to like this before as well. On top of that, Nebraska Beef is donating $100,000 to the food bank of the Heartland to be able to help those food insecure people. So great leadership there. And they have also announced they're going to be paying a one-time check of $1,100 to all the folks that work at Nebraska Beef. So again, another example of how folks in agriculture are stepping up to make sure that we can meet this challenge of this pandemic. And here to talk more about that is the president of the Nebraska Cattlemen, Ken Hers, who's going to talk about what our producers are doing here in the state of Nebraska to make sure that we continue to have that great, strong supply chain for food in our country. Ken?
Thank you, Governor, very much appreciate it. Taylor gave me a time frame to stay within. Sometimes I go off script, so I am going to read a prepared statement and try to get through this. I'll be available for questions and answers at the appropriate time. Nebraska Cattlemen is encouraging our feedlot members to have a workforce place and plan to ensure their workers remain exposure-free so they can provide the needed care of animals. We have helped seed stock producers announce their plans for online and phone sales of their production sales. We have asked them to structure times to view their offerings so that there are few people viewing at one time. We continue to stress the importance of following guidelines for those at risk by not attending sales. For those who do attend, to maintain social distancing by staying 6 to 10 feet apart, Follow good hygiene, covering your cough or sneeze, and wash your hands often. We ask sale hosts to provide for these measures for their attendees. For those attending livestock auctions, we are asking consigners to drop off their cattle, not to attend the sale. Watch online if the auction provides the opportunity. For those attending the sale, remember to maintain the recommended guidelines. It is essential that all livestock producers heed these proper protocols so that we can continue carrying on our business, utilize the speed of commerce, and continue feeding the state and the world. We also acknowledge that there are compounding market issues taking place. We are working with our federal delegation to address these issues in the short and long term. Nebraska Cattlemen website is updated continually at nebraskacattlemen.org. Again, we ask everyone to do all they can to reduce exposure so that we can keep the beef supply chain working. Thank you, Governor.
Now, Ken, I have never found you to be particularly long-winded, so, but I appreciate the fact that you kept it brief and to the point. And again, appreciate emphasizing that while we have business that needs to continue here in the state, like making sure we feed our state, the country, and the world, that we still want companies and people to practice that good social distancing. So, for example, we're talking about those sales that Ken was talking about in those auctions. Again, please make sure you still continue to keep that 6-foot distance. We need people to make sure they stay healthy and safe so they continue to make sure they can feed the world. So that wraps up what we have for our speakers here today. And as usual, I will now go into the questions and answers that we received online ahead of time. We only have one today, so we'll get right to the folks here in the audience soon. Kellen Hevican from KLIN asks, how many total Nebraskans are hospitalized with COVID-19, and if how many are recovered from it? So we have 9 people that are currently in hospitals in the state here in the state of Nebraska. So again, relatively small number right now. That's why I say we've got, certainly have the medical staff right now to be able to accommodate what's going on with coronavirus. But again, the reason for my earlier announcement about the executive order was to be able to make sure that we would be able to surge up or flex up that capacity with people who maybe have been retired from the healthcare system and want to come back and get re-credentialed, or to speed along the process or take out the red tape for people who are renewing their licenses or getting their license for the first time. That sort of thing. We want to make this an easy process. So 9 is how many we have currently hospitalized. Right now, we are not tracking how many people have recovered. That is something maybe we'll be able to do in the future, but we've really been focusing on the current cases right now, and I'll leave it up to Dr. Antone and his team to be able to think about how we might check the number of people recovered. But I do want to kind of just keep this in perspective, that we've had this now in our state for not quite a month, and we know that it doesn't take that long necessarily to recover from this, and especially if you've had maybe some of those milder symptoms. If you stayed at home, there's probably a number of people who are in our state that have recovered from this. So again, this is the kind of thing that you got to make sure you're taking care of yourself, staying home when you're sick, that sort of thing. But we'll see if we can't find ways to track that more specifically. So with that, I'd like to go ahead and now open up to questions and answers. If you'd like one of our speakers up here, please let us know that's who you want to talk to, and that person will come up.
Governor Ricketts, the USDA has expanded SNAP benefits online in several states, including Iowa. While trying to avoid large crowds, do you think it'd be great to expand those SNAP benefits here in Nebraska?
So actually, I think we got this question the other day. Is that right, Taylor? And we are still tracking down the answer to that right now. Is that accurate, Taylor? That is correct. So with regard to expanding those SNAP benefits, we're taking a look at that. We'll get you some news on that once we've kind of run this all down and can share more information specifically about it. Did you have any other, Taylor? Were there any other questions that came in online? Great. Yeah, Martha.
For the commissioner, I'd like to know how you are going to be able to judge the performance of kids when they're at home working like this, so that you know whether they actually have learned the materials and are ready to advance.
So obviously, we're relying on our local school districts, local teachers to be able to address that. We are exploring some options with our assessment vendor that has been widely used already for interim assessment to possibly allow students to be able to take those those assessments so schools could actually understand what the impacts are on learning as we come back in. That's not for accountability purposes, but an option that we're exploring with our assessment vendor in that case.
Commissioner Bloom said we have a question from Dave Schroeder with Caribbean. He says, could you discuss any innovative ways teachers are conducting distance or online education?
Yeah, I mean, there's, so the question is around innovation and in distance learning and online education as well. So first of all, there's been a lot of different activities that have been taking place. We've seen certainly teachers interacting with their students through Zoom and through other online environments. In fact, my own son, who's a fourth grader, last night when the governor and I were on NET, he was actually in class with his teacher, interacting with students at that point in time, his classmates in that setting. I think one of the key things that we're seeing teachers do, they really want to reach out and be in contact with their students. And we're seeing that type of direct access, that type of work taking place as well. But we're seeing for high school students that are engaged already, some of them right back into the content that they were working on through distance ed. Some schools were really set up and effectively able to move into that environment very quickly. Others are being thoughtful about the types of assignments that are taking place so they can engage with their students in the best way. So you're seeing actually buses take materials sometime around. You're seeing schools deliver materials to students and families, sometimes as part of their pickup, perhaps with food. There's a lot of innovation taking place around that space.
Commissioner, I didn't understand. The governor alluded to the goal being for everybody to advance to the next grade. Is that a promise or is that just a goal?
Well, so right now, the way that works, I mean, it's actually not a state function, right? That the teachers and the staff are actually making that decision at a school district level already. So that's not an unusual thing, that work is basically taking place. It's always been a conversation between parents and students and teachers to advance students to the next grade. So I think that's pretty routine. What we're basically trying to say is making sure that we're not stopping the year and putting everyone back a grade, right? I mean, that would not be the right result at this moment. Well, I think, so the question is whether or not everyone will be promoted. The schools are actually making those decisions about that. I don't believe that will change how they would make that decision regardless, so.
And a question for Dr. McDonald. Will the coverage of telehealth also include mental health?
That's a great question. Thank you for asking. Everything that would have been covered in an office visit can now be covered by telehealth, so certainly mental health services that would have been covered for an office visit in the past will now be covered with telehealth during this crisis period.
So not knowing what the pre-existing
Yeah.
policy was for in-office visits, which kind of things are covered and which kind of things aren't?
Yeah, I mean, that's a very complicated question that you've just asked, and I'd love to talk to you about it offline. It's a little extensive, but my point simply is we are now making telehealth available for those things that previously we would have required you to come in and see your doctor. And the idea is for safety, for access, and frankly, to allow those services to continue at a time when people can't get into their doctor's office.
And are you planning to revert back to your old policy at the end of this then?
That's a terrific question. Yeah, so that your question, are we planning to go back to the previous policy at the end of this crisis period? It's a terrific question. Honestly, we don't know the answer to that right now. We're in a situation we've never seen before. Right now, our policy is in place at least through, I believe the date, we've listed a date in our policy, and I believe it's June 30th, but we will certainly be reassessing between now and then.
We have a question from Paul Hamill. He says, can the governor comment on Nebraska's first COVID death? He says it is a 59-year-old man, or 59-year-old person in Omaha.
So I believe that, so what Paul is saying is that there's been a death of a 59-year-old man here in Omaha, and I'm not sure when that was announced. Typically what we do is we give you the announcements for the first thing in the morning. Is that right, Dr. Antone? So our 83 cases does not include that one. But I think probably the best thing I'd do is refer you to the Public Health Department who put that statement out, because we typically do it when we get it first thing in the morning. If that happens, after that happened, if there's an announcement after the first thing in the morning numbers, we don't necessarily get it to me right away. So I just refer Paul back to whoever put out the statement. Well, what we have, first of all, I would say, our condolences go out to the family. And again, since I don't know anything, it's very difficult for me to get more into details about this, but obviously condolences go out to the family who experienced a loss of a loved one. With regard to Nebraska specifically, we know we're going to be impacted like other states with regard to people getting sick, people having to go to the hospital, and some people dying. And the whole point of our efforts are to limit that as much as possible. We're limiting the spread of the virus so we can accommodate people who need to go to the hospital. And there's no reason to suspect that we're going to be immune from some of the things that are happening in some of the other states. And that's our whole goal around everything we're doing. And I'd say that, again, we implemented our procedures earlier, and that's why we've, for example, seen our cases grow more arithmetically rather than geometrically. And that's going to help us be able to take care of the folks who need to go to the hospital so that we can provide the type of care that will be life-saving.
Grant Schulte has a question. Do you anticipate that retired or new doctors will be needed, and any idea how much capacity they would add?
So the question was from Grant Schulte, do we think the retired doctors will be needed and how much capacity will that add? I don't have those answers right now. Again, we're really doing this in preparation of if we need to bring on additional medical professionals, that we would have the ability to surge that up, and that we're setting that expectation now, for example, with those healthcare professionals, that if they want to think about getting re-credentialed, now would be a good time to start taking those steps so that they can be ready should we need them. And of course, some of the other things with regard to deferring the renewals, deferring the license fees, all that sort of thing is around trying to make sure we've got that capacity to be able to surge up. We don't have the need right now, but we want to make sure we're prepared for the future. And that really gets back to our whole big thing about kind of three big things I talk about we're preparing is how do we get more PPE? How do we expand testing? How do we have more hospital capacity? This executive order fits into that latter category of making sure we've got enough hospital capacity. Yeah.
In regards to preparation, do you think that we have enough ventilators in the state should we start seeing more severe cases?
So the question was, do we have enough ventilators here in our state? Should we start seeing more severe cases? That's actually going into our overall analysis of what we're looking at with regard to hospital beds and ICU rooms and all that sort of thing. So we're looking at that right now and trying to get an idea of what our current inventory is, have some modeling of what we think it might be, and then use that to inform our purchases that would go into that first category of PPE. We'd put ventilators into that category of buying supplies. And so we will go out and try to purchase more ventilators if we think we need them. But again, we also have innovators across the state. We had, earlier in the week, Bryan Healthcare, Russ Gronwald was here talking about how they're converting 34 ventilators from their anesthesiology department into these ventilators that we can use. And we expect to continue to see that kind of innovation. And then also by shutting down that, those elective surgeries, what we'll see is the ventilators in those operating rooms will then be able to be used for patients in an ICU type setting, that intensive care unit type setting, to be able to have ventilators for that. So those are kind of a couple of ways right now that we're increasing that ventilator capacity in our state, even without buying something.
For the commissioner again, have schools run into problems with availability of internet access? Because I know there's parts of the state where it's not as good as others, and there are definitely families that do not have internet.
Yeah, and actually, so the question around internet access, especially at home for students around the state, there are certainly areas of the state that have a little bit more of a challenge on those fronts. We're looking at some solutions that would, number one, possibly help for places where they might have, certainly 4G using cellular as a possibility in some places. Other places still don't have even that capacity. School districts have used in the past, even where we've had limited home access, the ability to kind of broadcast their own internet, at least in a small area and around their communities. That's been happening for a while in smaller places. And then places where they know they have students that can't access that, they're really trying to work on materials that could be either downloaded and delivered or otherwise provided in some other fashion. So it is a challenge in some areas. It's also a challenge based on income. And so you're starting to see some proposals out there, I think, of few providers out there are starting to provide reduced rates for families that might not be able to afford that at home. I think that news is just kind of starting to come out over the last couple days, and so you'll see different providers putting that type of package out there for families. Home-based work's another, by the way, so I mean, even for our teachers, whether or not they have access, certainly we've tried to encourage that the schools are open for teachers to do work and encourage some flexibility around how that's done. So there are some of those challenges out there, but our schools are really well set up for internet themselves, so there's still some access points for us on those fronts. So I would just add, I think there's also some changes in E-rate that are going to allow for expenditures on that front, and I think honestly this moment in time will probably change our ability to think about access for a long time. I think there'll be a lot of interest in expanding access to homes.
Commissioner, are you aware of any schools still being open?
No, I'm not. Whether or not I'm aware of any schools being open in a normal setting, no. We actually have had, if you think across the state, we have private and parochial schools. Certainly, we have, and I believe they've all taken up my recommendation. All the public schools have taken up that recommendation. We do have a list of all the schools they've submitted something to us. So there's a full list of the schools that are now operating in this fashion. We actually have exempt schools, kind of a unique dynamic. We might consider the home schools, but there are actually some families that do group exempt schools, and we've called and reached out to all of them and asked them to also follow the recommendation.
And when you talk about reopening the state or local commission, it's still just a recommendation that you have schools to close. So if you haven't forced them to close, how do they have to get your permission or local company?
Yeah. I mean, I think it's a fair point, the fact that I'm making a recommendation. I would say, and the governor's behind me, I can say the governor's behind me on this question, but the reality is I think when you're starting to look at the situation and where the concerns are right now, public health has worked very closely with us. We've had regional phone calls with our ESUs and our school districts. They were actually making the choices to adjust what they were doing at a local level. That was with advice of their local public health officials, and so really I kind of expect to unwind it in the same way. I would want them to have that recommendation from local health officials as well.
And finally, we've got a lot of questions on the call-in show, but just mentioned one question about club sports. Parents are upset because their kids are involved in these things, and apparently some coaches are saying, great, schools are out now, you can practice more.
Yeah, and we're going to discourage that. I mean, first of all, schools have called me and said, hey, look, we've got folks that want to come use the school, and we've been pretty clear about not using that. It starts to change the kind of social psyche, I will say, of everyone. If you start to allow students to do that, then the NSAA had actually banned practices all the way through, I think, May 1st. So we're wanting all the kind of sports events to be consistent with that. You begin to undermine the effects of closing schools by gathering up students in different groups. I would be kind of, I mentioned it last night, but if you remember, our first case in the state of Nebraska was actually at a sporting event, not a school-sponsored sporting event, and that causes quite a bit of pressure on local public health officials to try to track down all those different connections. I have kids myself that want to be out practicing, right? I mean, I understand the ramifications of this, but the reality is the ramifications of not following these kind of recommendations are actually extremely challenging from a public health standpoint. And right now, I'd recommend that they're all following the same guidance that we've provided for schools. He was behind me. I saw him.
Yeah, I was behind you. I want to support what the commissioner was saying with regard to those club sports. Again, the whole point of the 10-person rule and what we're doing with our directed health measures is to prevent the spread of the virus. That means really limiting those large public groups. We're defining large right now as 10 people. So you can see how the club sports just don't really fit into that. Again, my kids, when they were growing up, were playing things like soccer and baseball and so forth. It's not going to be just 10 kids out there, right? It's going to be their parents, friends. It creates those large public crowds we're trying to avoid. So club sports really need to be thinking about that. And certainly where we have a directed health measure like we do in Douglas, Sarpy, Cass, Washington, Saunders, Dodge, and Lancaster County, it is very specific that you cannot do that. Okay, so that is something that we've got. It would, those large public gatherings of 10 people or more are not, or more than 10 people, are certainly for club sports, something you cannot do. So I also want to just piggyback on one of the things that the commissioner said with regard to schools having internet access. All the schools in Nebraska, at least all the public schools, have that high-speed access that has actually been facilitated by the state of Nebraska. And so if you have an interest in finding out more about that, we could connect you with Ed Toner, the Chief Information Officer for the state of Nebraska, and he could talk to you about what kind of speeds they have and that sort of thing. I know that some of the schools have even connected with the local library to expand that and offer that same sort of high capacity. For example, in Verdigris, I know that that was an example there. So one of the things the commissioner's talking about is that kids or their parents could drive up, get on wirelessly, and be able to access it that way. Not ideal, but that is one of the solutions to maybe download a homework assignment or something like that. But if you do have more interest on how that system works and how they're leveraging the backbone or the network that we have at the state, we can certainly make Ed available to talk to you more about that. And then there was something else around the schools, and I'm dropping, what was the other thing you were talking about?
Open stuff, I don't know if you.
Oh, the open stuff, right. So you had mentioned, Fred, about, hey, recommendations. Just in general, the way we're trying to handle this, and Nebraskans almost universally have stepped up and done the right thing, is not to be heavy-handed about this. Is to say, hey, look, folks, you get the idea, you get the big picture here. It's about limiting those large public groups. So common sense and good judgment. Please use common sense and good judgment. So when the commissioner's saying, hey, it's a recommendation, he's working with school districts and public health organizations to really do this in a collaborative sort of way. We're not trying to do it in a heavy-handed kind of way here. So now, obviously, where we have a directed health measure, like in those counties I just listed off, that is part of the directed health measure that schools operate without students. So that is part of our directed health measure. But what we're trying to really do is make this something that is a collaborative thing and work together so that it's not, the big heavy state coming down on top of you, but really helping everybody understand why this is so important to prevent the spread of the virus here in our state.
Do you think you'd ever have to issue a stay-at-home order for the entire state of Nebraska?
So we have no plans to issue a stay-at-home order, as you may have seen in other states. And part of the reason for that is we've actually been working collaboratively with our experts at UNMC, Dr. James Lawler, who's going to be on our Facebook Live. So if you want to get more information about this, tune into my Facebook Live, 3:30. But the idea is we put together this plan weeks ago, and it never called for a stay-at-home order. What it calls for is what we've just been talking about, reducing those size, those large public groups. And when we say large, at this point, we mean more than 10 people. And so we have done the most restrictive measures we are going to do in places like Omaha and Lincoln because we've hit those thresholds, those triggers of having the community cases that gives us an indication that the spread of the virus is starting to rise in those communities. Now, we're handling this on a regional basis across the state of Nebraska. So as we have more of that across the state, we will issue more directed health measures if necessary. But because we are taking these proactive steps, and it's really again about limiting those large public gatherings, and because our state, relative to some other states, is much earlier in this cycle when we're taking these steps, that's the steps that are going to be appropriate for our state. Now, New York State's very different. New York State probably had virus mid-January at some time, or maybe even earlier. And so they were not taking steps because they just didn't have an awareness of this, that this was coming to them, and so they maybe have to take more restrictive measures. But what we're doing here at the state, because we don't have direct flights to China, don't have those people coming in that would spread the virus here, we don't have the kind of spread of virus in our community. The steps we're taking are appropriate for our state and do not involve having a stay-at-home order.
What are the thresholds for a stay-at-home order throughout the entire state?
Again, that's not part of our plan. We don't have any plan to do that because we don't need to. Because we are taking these steps around the 10-person rule and limiting the public gatherings, that we will not need to do a stay-at-home order because we're doing all these things early and really slowing the spread of the virus. And again, what I'm talking about, like, just 9 new cases from yesterday morning to this morning, it shows that so far, again, we've slowed that spread of the virus. Now, this is going to be this is not something that's going to be done overnight. We are going to have to keep a sustained measure of this at some level as we go forward. But right now, we are staying ahead of it to be able to slow the spread of the virus, and especially in the areas where we have it more widely spread in the community, like places like Omaha and Lincoln.
We have a question from Bill Shammer. He knows that you guys have hit on this already, but do you envision a situation where there are graduation ceremonies in mid-May? Is it possible to postpone them until the summer? Or will this be a senior class that will likely miss out on that moment?
Commissioner, you want to take this one?
So the question was about graduations and whether or not they could happen kind of at all. By the way, I have a senior, so I have to answer this very carefully. But the reality for us is, again, kind of looking back at where are we at from a public health standpoint? What are the recommendations? I've been asked about, could we do it in July or August? There's no prohibition. They could do graduation when it's safe and appropriate for them to be able to do that. I've heard of some pretty unique things already with some kind of online graduation and activities and recognitions. So it's going to depend on the circumstances that we face at that moment in time.
And if I could just piggyback on that answer again. So as we go down the road with this, and we're talking about, sometime in the summer, if we loosen restrictions, there might be the opportunity to have larger groups of people get together. And so, again, that's something that we'll work with the commissioner and the local public health folks, that if we decide that it's appropriate for us to loosen some of these restrictions to get above the 10-person rule, then there may be the opportunity to do bigger groups of people getting together. Whether that actually meets the needs of somebody's graduation ceremony, I don't know that I can say that. But there may be an opportunity down the road as we get into late summer like that we will be loosening up some of these restrictions.
Governor, yesterday you issued an executive order in regards to childcare. And some of the folks who have been in the field for a long time are concerned about that because your executive order allows other entities to come in to compete with them without having to meet the same requirements. Do you have a response to this concern?
Sure. So the question was, there's a concern among the existing child care providers that by issuing the executive order I issued yesterday that allows for temporary child care, that you're bringing people into the industry to compete with them. And what we're actually trying to do is actually replace the capacity that was lost by going to this 10-person rule. So you may recall that, again, when we went to 10-person rule, we said part of our guidance for childcare and daycare facilities is that you could have no more than 10 children in a classroom. And so if you only had one room at your childcare, that meant 10 total kids. You might have had more there before, or you might have had a facility where you were taking care of, say, 200 kids, but you only had 10 classrooms, so now you can only take care of 100 kids. And so what we were hearing is that parents were losing access to that childcare. And we asked those childcares, those daycares, to prioritize our first responders, our healthcare workers, firefighters, police, EMTs, correctional workers, that sort of thing. So what we're trying to do is create more capacity, again, for those folks that are involved directly in public safety, like healthcare workers and first responders, to make sure that those families will have the ability to put their child someplace so that they can go to work. And also, I would remind all those folks that were in the industry before that this is temporary. This is really only as long as this emergency lasts, and they cannot take up the capacity they had in the past. So since we lost some capacity with the 10-person rule to provide daycare, this is a temporary rule to allow for more capacity to come back up and help families out by taking care of those kids so that those parents can go to work. Other questions? All right. Seeing no other questions, I will again thank you all very much for being here this afternoon. I want to thank each of our speakers who came and talked about their respective areas that are so important for our state of Nebraska. And again, I just want to say thank you to all the Nebraskans out there who have been working so hard over the last month to slow the spread of the virus here in our state. This is something that is absolutely critical to prevent those folks in our state who are going to be the most vulnerable, people who have those underlying health conditions, older Nebraskans. We need to make sure that we are slowing the spread of the virus so when those folks who need to go to the hospital go to the hospital, we have the facilities to be able to take care of them and help them get better. There is no vaccination for this yet. There's no antiviral meds right now. What we can do is what we call these non-pharmacological interventions, the social distancing, the 6 feet away, staying home when you've got those flu-like symptoms like fever and cough, limiting groups to 10 people. Those are the things that will make a difference. As we do all those things, That's what will slow the spread and make sure we have the hospital capacity to take care of the people who will need it when they need it. So thank you all again for everything you're doing to be able to make that happen here in our state. We've got the best place in the world here in Nebraska. You can see it from the great leaders that are making a difference here in our state to be able to make sure that Nebraskans stay healthy and safe. Thank you all very much. God bless and have a great weekend. Commissioner? Thanks, Ken. Appreciate it. Bill, thanks, guys. Appreciate it. Appreciate you guys. Thank you, Francis.